Hi, my name is Dr. Sunkaru Touray, and I'm a pulmonologist and a critical care physician from the Gambia. Patients with COPD in the Gambia have several treatment barriers, first among which is a general lack of public health awareness about risk factors for COPD. Although many people recognize smoking as a risk factor, in the Gambia, household air pollution from the domestic use of charcoal and firewood for cooking is another significant risk factor for COPD, in addition to ambient air pollution from exposures to particulate matter from combustion and also from vehicular exhaust emissions. Patients who have symptoms due to COPD often face barriers to diagnostics. There's limited access to spirometry in the public sector. You find that patients are usually unable to receive proper testing and confirmatory diagnostics in the Gambian context, and so they keep getting progressively worse because of a lack of that diagnostics. The third item also is the lack of access to inhaler therapy, both in the public sector and also in the private sector, which is primarily driven by a lack of access to these medicines in the essential treatment guidelines for the country, and also in the procurement at the government level. So patients have to buy COPD inhalers in the private sector, and usually these are quite expensive. Pulmonary rehabilitation is also not readily available for patients with COPD, and so because of all these reasons, many patients continue to suffer and experience significant symptoms from the disease. If I had a magic wand, I would ensure that all households in Gambia use clean energy for domestic cooking to reduce the harmful effects of air pollution on lung health. I would ensure that all patients with COPD have access to correct diagnosis, inhaler treatments, pulmonary rehab, and vaccinations so that they can lead healthy and productive lives. It is critical that decision makers and policy makers listen to the lived experiences of patients with COPD to understand the barriers they have in accessing care. As a healthcare professional who cares for patients with COPD in Gambia, many patients do not have access to treatment, and these individuals continue to suffer needlessly when there are effective ways of addressing these issues. It's about breaking down barriers and building bridges to create a sustainable model of care for people living with COPD in the country. My name is Dr. Sunkaru Touray. I advocate for all patients living with COPD.